Hey guys, hello, namaste. I'm Ajay, final year student from DMSF Philippines. So guys, after a long time, so hope you are all doing well. So I'm also good, a little bit busy in my rotations. So currently I'm in pediatric rotation. Okay, so actually just I would like to share some information about in final year, like what we are going to do, like what are the procedures we are allowed to do to perform in fourth year. So guys, for up to level, for our level, as we are a clerk, not a intern. Okay, we are a clerk. So what is the purpose of a clerk? Doing paperwork. So like for our level, for clerk level, what is the main aim of a clerk in final year is that you have to you have to master in you have to be perfect in a good history taking. Okay, you have to perfect in the good history taking. Suppose like a history taking, like a chief complaint and present illness. Okay, and also the past medical, personal social history, PE. Okay, chest and chest and lungs, auscultation, percussion, inspection, cardiovascular, and river system. Like this, we have to be very perfect. We have to be perfect in these areas as a clerk level, as a fourth year. Okay, now so make sure that you are perfect in these areas. Okay, what are the history taking and physical examinations? You have to be perfect, very perfect in these areas, and you have to know what are the questions you have to ask. Suppose example, there is an emergency case. Okay, so what are the questions you are going to ask? We are not we are not going to ask the comprehensive questions, comprehensive history taking. To ask only the focus history. It means that is related to the disease. That is, you have to know about the how to take the history, and you have to know the difference between the what is focus history and comprehensive history. Okay, and guys, so apart from the history taking and doing physical examination, and but mostly we are going to focus on these only. Okay, we have to perfect in this, and also guys, we are going to perform some procedures and skills, like I know that inserting the IV. Okay, IV, I know that in second year onwards we are going to learn in the how to insert the IV lines. Okay, and then you have to going to learn about we are going to perform the venipuncture. Okay, venipuncture, and also about the how to do the ABG, blood extraction, arterial blood. Okay, extraction. And also guys, we are going to learn perform like some NGT, nasogastro tube. Okay, and also OGT for the small childrens. And also and also we are going to take the vitals of your patient. What are the vital? Heart rate, O2 saturation, BP, and the respiratory rate. These are the vital signs we are going to take for your patient. Okay, and so they are the only they are things we are going to do in the final year. And also rarely we are going to prescribe the medications. Also we have to write the prescription form, prescription writing. Okay, so since we are clerks, so we are not allowed to write the prescription, but in some government hospitals we are also okay with to write the prescription. So after writing prescription, the intern will check our prescription. Okay, so we are going to write the prescription form also. Okay, so prescription writing, and also doing some small procedures as I told you earlier. So there are things we are going to do, and also we are going to learn we are also going to learn about how to study the doctor's handwriting also, because we are going to see the chart of the patient. There are so many writing like that. So we are going to study this one every day. Every means you can clearly understand that okay, this is the CBC. Okay, this one like the clear breath sound. Okay, percussion, auscultation. Okay, like this dynamic precordium. Okay. Then you can clearly understand that okay, what they are writing. So this is the stage we are going to learn how to read the doctor's writing. Okay, and also you are going to see the patient chart, like what they are ordering. Okay, so this is the very important. Wherever you go, there is patient chart, and whatever the doctor's order, you have to study. So we can clearly easily know that what the today's order, lab findings, all of this. Okay, so and what is the purpose, like what we are, and also what we are going to do is and also what we are going to do is that in some hospitals, like they will assign you some patient, like to one patient for each members. So we have to write the SOAP notes. What is SOAP? Subjective, objective, assessment, and plan. Like you have to go to your patient and you have to ask. Suppose the patient is having dengue, so you have to ask, ma'am, sir, you have to ask, sir, do you have the abdominal pain? Do you have the bleedings? Any signs of bleeding, body malaise, vomitings, and body weakness, fever? You have to ask, like the subjective. Objective, you have to take the vitals, and assessment, you have to know that what the diagnosis of a patient, and the plan. What's the plan? You have to write the like. So this, we are going to order the D5 PNS water solution, IV fluids. We are going to prescribe the paracetamol. How much time? So we have to write down your SOAP notes. Okay. So this is what we are going to do in the final year. So this is too much, I think so. But because in intensive we are going to learn a brief. We are going to do a lot of works regarding this. So for the clerk level, just you must perfect in the good history taking and PE. Okay, so this is the best one. Okay, so this is all you are going to do in the final year. And if you are doing other than this, it means you are perfect one. So bye bye.